When people are trying to choose an electronic health record vendor, it's very confusing to them. In fact, many times I'll go to conferences and I'll see groups of physicians, groups of administrators walking around like zombies from table to table, looking at screens, looking at screens, looking at screens, not knowing what they're doing, getting out and being more confused than ever. There is a logical process you have to follow, and you really have to understand a lot of factors. You have to not only understand what you're looking at on the screen, but you also have to understand what the company's about. You have to understand what their technology is about. You have to understand how they do implementation, how they do support, how they're different from everybody else. I have heard of many horror stories where a physician group or a hospital has gone and purchased systems that looked really good, but then they got it in and they found out it was terrible technology, or they found out the company was insolvent that they should have learned in their due diligence process. So the point is, in vendor selection, you have to follow a logical process leading you through. That's a lot of what I do with practices. I help facilitate them doing this because it's hard to realize all the steps. What you need to do is, the first thing is, you need to decide as a practice, as a hospital, or as a community health center, you need to decide what you need from your electronic medical record system and what's important to you. So for example, I've worked with a lot of groups. Web portals, patient web portals are a good example. The ability for a patient to get their clinical information through a website. One group of practices thinks that it's really important and I really want to have web portals. Another group might say, you know what, it's not as important. So the point is you follow this process. You try to understand what your needs are. You try to look at the clinical features of an EHR and then understand what's important to you. Because no EHR is going to do everything for everybody, so you need to understand what's important for you. What people don't do, though, is they always seem to just stay on the surface. They always seem to just look at the screens or the features from a doctor's standpoint. But how about the company? Okay, isn't it important the company's solvent? Maybe they have some money in the bank. Maybe they have a lot of employees. Maybe they have good references. What people don't do is they don't look enough into the company itself, and there's ways to do that. The third thing is that what people don't do especially is they don't look at the underlying technology. Getting this technology, getting an electronic health record system is kind of like an iceberg. If you look at an iceberg, you have 10% on top. That's what doctors, that's what administrators, they look at the screens, they say, this looks pretty, it works well. That's the 10% on top. What they don't see is the 90%, that's the technology it's built on. I was consulting with a group, a large group of 50 practice IPA, Independent Physicians Association, and they chose a vendor, and a local hospital system offered them money to choose another vendor. So we did research on the other vendor, and we found out that the technology they used was 20 years old. In other words, if they had chosen this vendor, they would have been stuck. It wouldn't have been interoperable. It wouldn't have been scalable. They would have been held hostage by older technology. So that's another area. So as you can see, many practices look at one thing, one component, how the thing looks, how the EHR looks. But there's a lot of other things. What you do now is you take all this information and you turn it into what's called a request for proposal. Now, a request for proposal document is really important because you get everything down on paper, and you go to a vendor and you say, this is what I want, this is my expectations, and then the vendor has to come back and they have to basically say, yes, I can do this, no, I can't do this. Now, that's really important because now you have an apples-to-apples comparison, right? If you have 10 vendors and you're comparing them, now you have a document, and you can take this document with one vendor and a document with vendor B and vendor C, and you can sit down and you can evaluate. Okay, so it's very, very important. It's work, it is work, but it's very important to do this, and I like to help people through this process. It's a new process for most people, but it's really important.